Hi, Dr. Belziki. Very good to see you again. I know you mentioned you had an emergency, and I'm very eager to hear about the case. Can you tell us about it in 5 minutes?
5 minutes, I'll do my best. Patient called, flossing a crown that had been in his mouth for some 30 years, and I had placed it. The crown came loose. This was on the weekend. I said, come in Tuesday morning, 8:30, and I'll re-cement it. Well, as you can see, when he showed it to me in the little plastic bag, that's most of the tooth structure that the crown was sitting on is still encased in this crown. So going to the mouth, I knew that I couldn't re-cement this. Tooth has been in his mouth for some 31 years. This is dark and stained, but solid, and it was not foul smelling. So it must have been a fracture, some catastrophic break from cyclic fatigue. So there is the radiograph that was taken showing endodontically treated tooth. There is no fractures, nothing. The tooth is 100% solid. Here it is in 1989. And I had done the endo and crown placed. So some 31 years later, this is 2016, it's held up quite nicely. So if I can restore this tooth, it should give him another 31 years.
And the interesting part, there's no decay.
There is no decay. First of all, I use cement, the poly-F cement, which doesn't promote decay, and it's just that cement just holds up decade after decade. So when it did break, this is rock solid. This is gutta percha. It's a little bit stained too because I had placed the amalgam right on top of the gutta percha. At that time, I thought it would be good to fill most of the chamber with gutta percha, leaving a back door in case I had to redo an endo or somebody had to redo an endo at some point. Going through the crown and the core, hitting the gutta percha would be a good landmark to go easy. So here I'm just removing the bulk of that gutta percha. You can still see it's white and clean. It doesn't smell. So I knew I was not dealing with an infected septic tooth. Just cleaning that up, removing most of the gutta percha. And here you can see the orifices that are there, just engaging that slightly. So I will use as retention the interior chamber anatomy. And then I had placed 5 self-shearing retentive titanium TMS pins in this tooth. Put a matrix band on. I'm using amalgam because amalgam is durable, predictable, and doesn't care about moisture. Pack it with amalgam. Once that is a little bit hard, I can remove the band, take a Holland back, and just go around and carve the prep by hand. Because I had done the axial preparation and the margins before the core was placed. At that time, it's easy. The visibility is beautiful without the core in place, just to refine a new margin. VPS impression material in a full arch custom tray. I give the lab as many landmarks as I can to help them give me a crown back that will fit nicely. And here you can see, being honest with oneself, that indeed one has a clean margin. If you can provide excellence, then you can expect excellence back from your lab. I had taken a study model of the pre-existing broken tooth and just blocked it out with blue blockout material. I'm going to make a provisional using powder liquid methyl methacrylate, draw a sheet of acetate onto the model, and this acetate is one that will not adhere to the resin material. Take a knife and score a line on the buccal and on the lingual. It frees up that little segment, fill it with denture acrylic, pop that on. I like using these clear sheets because I can see accurately that I've indexed it properly back into position. It sets on the bench. I will remove the excess. Oh, there's the margin that I've marked, so you can see the margin is picked up there. But I know that this material shrinks a little bit. It can distort. My little plastic shell can distort. So I know this is always a 2-step dance. I will then hollow grind the provisional, flood it with some new soupy resin material, plop that back on, and then remove it before it sets. Now I have faithfully picked up the margin anatomy in the acrylic. So it's just a matter of knocking that off and it pops back on. The tooth has been endodontically treated and went with a crown for 31 years. Having done this, once I get a crown back in a week or two, it'll go another 31 years. And that's as fast as I can do it in 5 minutes.
That's a beautiful tooth. Thank you so much. And we'll see you in the next 5-minute case.